We talked, you mentioned earlier, we were talking about the dental coverage issue. Had you requested, or familiar with something that's called a geo-access report? My understanding, that's something that identifies that someone who, if there's someone in their plan that's someone that's in the plan that's provided, but they voluntarily choose to go to a provider outside of the plan.
I know the geo-access report to show that maps where the participant resides versus how close that is to a. Might just stop.
Try the other one. You probably used too many words in that one, couldn't handle it anymore.
Was that used for this? The question
I will endeavor to be more pithy.
I guess the question I really wanted to ask was, did you do a geo-access report in your analysis of people operating outside of the plan when you talked about the periodontic and orthodontic people operating outside the plan? Did you do any analysis of whether those were voluntary decisions or based on that there was unavailability of people within the plan?
No, I did not.
Okay.
Bill Walt had asked for the disruption analysis, I think.
Yes.
And does the disruption analysis show Delta Dental versus Concordia?
It shows Delta Dental.
Okay. And is Delta Dental based on your experience, in the rural areas?
Yes. Has greater provider participation. If you want to compare it, like AT&T versus Horizon,
Right.
And Delta Dental being the red Verizon, they cover a greater area than the blue of AT&T, which would be United Concordia.
What would be the increased administrative cost to the fund for having the second dental plan?
I don't believe that there will be an increased administrative cost. I believe there might be a couple points of benefit cost increase because
Smaller number of participants for the...
Smaller number of participants, and whenever you have, you're paying a premium for a broader network.
Right.
Just so, Joe, I'm clear on this. There's no proposal that we change to Delta Dental, is there?
Well, technically, yes. If you look at the proposal, it does say switch from United Concordia to Delta Dental because of the network.
Because of the network, and you asked us to take a look at that.
Yes.
Okay.
Regarding the healthcare premium that proposal that you outlined,
Disappearing co-insurance.
Disappearing co-insurance. First of all, you mentioned that the focus of what you would like to accomplish is preventative care.
Not preventative care, you're getting the appropriate care.
Preventative and appropriate care.
Yes.
And that an appropriate Get Healthy program is a large assistance in doing that.
Yes.
In that, why would you provide any reduction to people who choose to participate, who choose not to participate in the Get Healthy program? Wouldn't the better avenue to be to provide a larger stick to say, the larger stick to say, the Get Healthy people will go down, but if you don't, the Get Healthy people, there should be no incentive for not participating in the Get Healthy program.
Perhaps you misunderstood my earlier testimony, so let me repeat it. As a matter of fact, I thought I was pretty clear, and I said, even if the bargaining unit achieved 80% participation rate and thereby nobody had a premium co-share, I would urge that anybody targeted for Get Healthy or whatever the disease management program is, even if they didn't participate, even though the rest of the bargaining unit achieve that 80% level, they should have a premium co-share.
Could you accomplish that through other means, such as an increased deductible?
Yes,
Same effect?
yes.
Okay.
A penalty deductible.
Yeah.
How'd you come up with 500 in your plan? Why that number?
Actually, I had proposed a lower number, and the union trustees said, no, it should be 500. We've got to get their attention.
And if you take a look at the average salary of a corrections officer, which I think you testified earlier, it's about $41,660.
That was the figure that was given to me.
Given to you, I believe. And the difference between, for such a salary, if you took the difference between the 3% and the 1.5% under the current the current premium share that they pay out of salary, that would equal about $600.
That is correct.
But yet the participation rate is, I think as you said, around 30%.
Yes.
So it may be even better to provide an even higher amount as a stick to ensure that people participate in the Get Healthy program. That it's
As I said, there are two ways to look at it. You can look at it from the point of view of a stick, or you can look at it from the point of view of a carrot. And knowing, it's a fundamental principle, there are three fundamental principles of consumerology, behavioral economics. And one of them is that you will work twice as hard to keep something that you have, rather than go after something you could gain. And where you have a combination of the two can be very powerful. So in the proposal, you see that people still have a percentage co-share. They still have an incentive to participate. What you're doing is, in addition to that stick, providing an additional carrot, giving them a way to not only preserve what they have, but perhaps even earn even more. And the other fundamental principle of behavioral economics is that peer pressure is extremely powerful. If I participate in Get Healthy, and my coworker sees that, and he sees, hey, that's a good thing, he's more apt to do it. Much like, I'm sure you've had this experience where you have Girl Scouts coming down the street, and they knock on your door, and they want to sell Girl Scout cookies. And they present you with a list. And you look at the list, and you see that your neighbor Joe bought 3 boxes. Well, you don't want to seem like a cheapskate, so you're going to buy at least 3 boxes, maybe 4. That is a very, very powerful thing, that peer pressure. If it's good enough for me, it must be good enough for you. If it's good enough for him, why isn't it good enough for me? Those things in combination, that working together to garner that participation is what's critical. And you can do it with not just a stick, but I think more effectively with a stick and a carrot.
And I guess what I'm trying to outline is, why not keep the stick at the same level and increase the carrot? You're saying, why not say to the person, why not, doesn't your proposal say to a person, even if everybody else does it, I can still get a benefit by not participating in the Get Healthy program. I can still get a benefit because that number is going down under the proposal that's outlined here.
That number is going down. Everybody shares in the reward of lower costs, the Commonwealth, the employees, but more importantly, again, I would emphasize, again, what I said was that even if you achieve those levels, keep the stick there for the guy that's targeted for Get Healthy participation and doesn't participate. In
the Teamsters healthcare plan that you administer is, let me ask this question. Let me strike that and ask a different question. Isn't a more direct correlation in order to tie savings provided by a Get Healthy program, to tie one's premium, the percentage to premium costs rather to one's salary?
That's only if there's a level playing field and somebody isn't playing fast and loose with costs and reserves and lowering contribution rates.
Well, you're talking about, you're talking about different, you're talking about the AFSCME stuff, is that what you're talking about? Is it?
Perhaps, yes.
Okay.
Yes.
Okay, well, let's say if you, but in terms of, if there was a tie to say, that you're tied to, your premium is based on a percentage of the healthcare, the percentage that the employee pays is based on a percentage of the healthcare premium, and that if the cost for administering the correction officer's plan goes down, those costs to be shared with those costs to be passed on to the corrections officers. The Commonwealth maintains the same payment amount, but if the reserves, like if you said, if the reserves go up so much, that they should then pass on those cost savings to the employee to reduce their share.
Let me see if I understand your concept, your question. Is your concept that you take the costs of the bargaining unit, this bargaining unit, now, okay, and you encourage participation in Get Healthy, and if the costs are within a certain band, there's no change. But if the costs fall below that certain band, a percentage of those savings, the difference in cost, is then shared with the corrections officer so that his or her premium is thus adjusted downward.
Correct. And if the cost goes up, then the cost goes up for the employee. So because you're basing your plan, base it on percentage of people participating and an expected reduce in cost to the plan based on your expectations. You're saying that we're going to reduce this because the Commonwealth's not going to, and PEBTF is not going to have as large of an obligation. The cost for administering these plans is going to go down based on just the fact that people participate in the Get Healthy program. But if you, correct? I mean, that's basically your argument, is that we can reduce the share that our employees pay because there are going to be savings associated with the increased participation in the Get Healthy program.
That is correct.
Okay. So, but that's an assumption but based on your experience.
I think it's borne out by all the experience and the articles that I've read.
But wasn't there also a direct correlation? Wouldn't it be to have a direct correlation to say, okay, if the cost, tie it to a percentage of one's salary, I'm sorry, percentage of the premium, the corrections officer is paying a percentage of the premium, and therefore, if the costs go down, those costs get passed along to the employee, and if the costs go up, they get passed along to the employee. But based on
what you're proposing then is not a percentage of salary, but a percentage of planned cost.
Correct.
That is another way of doing it, yes. Okay, but
wouldn't that more effectively be a direct correlation to ensure that the